Hi, Tracy Tyson. I'm a pediatrician in Vermont, and I wanted to talk about a common problem in pediatrics called febrile seizures. Febrile seizures are really scary to watch in your child. I saw them in the emergency room, I saw them during residency, and I certainly have seen them in my own children as well as seen them in my practice. So I thought it was something helpful to talk about, and maybe we can dispel some myths and fears and help families understand why this happens and what they could do if it happens to their own child. So, what is a febrile seizure? A febrile seizure is a seizure in a child, usually between 6 to 60 months, in the setting of having a fever. And so it has to be in this range. They have to have a fever, they have to be in that age range, and there has to be nothing else that we can find wrong with the child. So, what are they? We think what happens is for multiple different reasons, the brain is immature. It's abnormally firing sometimes anyway. We've all seen our kids do some odd things when they're sleeping, odd movements. And so babies in general have some immature brain activity, as well as they do sometimes have a genetic predisposition for this. And so I always like to think about a febrile seizure as like a pot of boiling water. If the lid is on the boiling water, it's usually contained, but as soon as the lid is lifted, it can boil over. That's kind of what a fever does to a child who has this genetic predisposition in that age range. It decreases the threshold and it allows everything to boil over. It's not so much the level of the fever. We used to think it was how high was the fever, but that's a whole different conversation related to previous infections. So we now have herd immunity too for Hib and Prevnar. But now we know that it's really just the fever in the setting of everything else. So I've seen this at 100.9 degrees Fahrenheit. I've seen it at 104 degrees Fahrenheit. And so I really don't think, and studies don't show that the actual level of fever matters so much. It's really just the fever itself in the setting of the child with this genetic predisposition. So this happens in 3 to 5% of US children and worldwide as well. And so it's common enough that it's something that most people have heard about. So what is the most common cause? The most common cause in the United States right now in a fully vaccinated child is a virus. Influenza being number one, adenovirus, which is a common virus, runs around a lot during summertime, but also sometimes other seasons where you get bright red eyes, red ears, sore throat, rashes. It can really be mistaken for strep throat. Those children can also be more prone to febrile seizures. But I've seen it from every virus that you can imagine. And often we don't know which virus caused it. And so anything that can cause the fever can also cause the febrile seizure. So vaccinations can also cause febrile seizures in children if there's a fever. So as we well know, vaccinations induce an immune response without causing the cell damage to the person. So the immune response is going to be the same as the response that it would be if you had the infection in most cases. So MMR is a common vaccination to see febrile seizures in, although it is still less common than measles itself and less common than influenza itself, but it does happen in less than 1% of the population. They will sometimes have a febrile seizure, especially if they're prone to seizures. Why does it happen? It is because, again, the fever rises in an immature child. The times where we give the MMR vaccination is around the 1-year-old age range, so it sets them up perfectly for that. Is it dangerous? No, they're not. We used to do a lot of workup on children. We used to do blood work and EEGs and monitor them and CAT scans and keep them in the hospital overnight back when we had so many other causes of seizures with fever in children. But since modern day vaccinations and children are not suffering from as many bacterial infections and not suffering from as many neurological infections, simple febrile seizures are self-limited, meaning that they are going to go away. The child is not going to have any long-term complications, and you don't need to do anything about them. So what makes it a simple febrile seizure? There has to be certain things that occur. Again, that age range, that 6 months to 60 months, is really important. The fever needs to be documented. Often caregivers do notice that there was no fever prior to the seizure. The seizure happens, they call 911, they rush the child to the hospital, and when they get to the hospital, they have a fever. And so there has to be a fever, but often it is not the first sign that the family notices. So it's usually not a real great way to prevent it because you don't even know the child is sick. The seizure activity needs to be generalized, meaning that it's usually both sides of the body. It's not just going to be one area moving or just staring into space. It's actually going to be a rhythmic jerking, what we call a generalized seizure in most cases. It needs to be less than 5 minutes, and the child needs to be completely back to themselves within 30 minutes. And so if there's any prolonged effects, you cannot say that's a simple febrile seizure. If there's any other abnormalities to the movement, if there's any signs of other central nervous system infections, like we would be more suspicious of something like encephalitis or meningitis, you cannot call that a febrile seizure. So why would I call this a febrile seizure? If it came into me, what am I looking for? I'm hearing a history of a child who was previously healthy, has no other medical problems, has a seizure-like activity less than 5 minutes in that age range, has a fever documented, and when I examine them, I see no other signs of significant infection. And so that is how we would classify them as simple febrile seizures. Studies show, after looking at this for decades, that there is no long-term side effects to these children, that they recover just as they would from any other viral infection. There is a slight increased risk. Remember, we talked a little bit about there being a genetic predisposition. Children who have febrile seizures do have a slight increased risk overall of developing epilepsy. It's not so much that the febrile seizure causes the epilepsy, it's that they had epilepsy already, so they're more prone to seizures in general. And so right now, how we treat them in the United States is supportive care. We look at the child. If they have a viral syndrome, we might give Tylenol, ibuprofen, lots to drink, rest. If you see something like an ear infection, you might be more prone to treat it, but it's really just evaluating the child like you normally would if they have a fever. Lots of reassurance, and nothing we do differently the next time the child has a fever. So in a simple febrile seizure, it's just making sure the child is okay, getting them medical care so you can prove that that is what is happening, and then nothing you really need to do differently in the future. Your child is a little bit more prone to them. So certainly once you've had one febrile seizure, you are slightly prone to have one again. And so we just tell parents, if there's another fever, obviously watch for this to happen. If something like this happens again, let us know. If the seizure lasts longer, like for 5 minutes, or they're happening over and over again, certainly we would look for other causes. That's when a child might need to be referred to a neurologist and get an EEG to look for abnormalities. So they're not dangerous. They're caused by viruses most commonly. They can be triggered by vaccinations because you can get a fever from a vaccination. However, we know that the seizure is more common with the natural infection, so still getting the vaccination is better. We know they're self-limited. We know that there is no increased risk to the child after that time period. We know there's a genetic predisposition, so we're always on the lookout to make sure that if seizures continue, that we're looking into whether or not the child might develop epilepsy later in life. So I hope this helps. I hope it dispels any rumors that vaccinations cause febrile seizures. They can certainly contribute, but it's not our major cause. And again, any effect you can have from a vaccination is the same effect you could have from the infection without the complication. So it's still better to have the immune effect from the vaccination and not have the cell damage than to have the actual infection itself. So I hope this is helpful to someone. If you have any questions about it, talk to your pediatrician. There's so much more information out there, but I wanted to give just enough information so this maybe wasn't so scary. And if you hear about this from a family member or if your child has one, maybe it gives you a little bit more background information and makes it less scary. So take care, stay safe.